Yes, ma'am.
How do we get the stream to work?
Is it on the county?
Click on Commissioner Videos.
Commissioner
Go to
video
our
icon,
homepage.
www.maconnc.org.
bottom left.
Yeah, got it.
Click on Commissioner Videos, the bottom left.
Okay, it's on.
Yes, it should be up.
It's a little icon.
You put that website on, it realized there's a website.
That's just the live stream. If you want to actually talk to us, you'll have to use the conference call.
We want to be able to see it to Macon County, NC.
MaconNC.org. www.maconnc.org.
Okay, thank you.
But-
I didn't realize that. I understand we have to still talk, but.
Yeah, it's view only, but you can talk through the phone.
Okay.
Close enough to go.
Thank you. Has it started yet? Oh, has it started yet?
We're getting ready to kick off.
Okay, all right, thanks. I'm gonna put you on mute until you need me to talk, okay?
Yes, ma'am.
All right, I'll call our emergency meeting to order on March 17th, 2020. I would like to welcome all of you that are in attendance, a little smaller crowd than what we had last Tuesday. The primary purpose of today's meeting is to, I guess, let the public know, let us know, let our county staff know that we are here to do everything that we can to protect the health, safety, and well-being of our Macon County citizens. And we're going to be hearing from some of our county staff today, as well as others. And we're going to try and just ensure that we are headed in the right direction. As chairman of this board, one of the items that gives me solstice as we discuss this, I know we've been beat up politically for this in the past, but as knowing that we have a very healthy fund balance right now. Some people might call it the rainy day fund, but I can assure you that it makes me feel much more confident and eases my sense of responsibility as a commissioner, knowing that we have approximately 6 months of expenses set aside. I do have a fear that our budgets could get blown very easily for a number of reasons. Number one is we're obviously going to have some unexpected expenditures and how we handle this unprecedented issue. And also, there's a good chance that our projected revenues are not going to meet for obvious reasons. So with that being said, unless another commissioner would like to address everyone, we'll get the ball rolling. Mr. Manager.
Thank you, Mr. Chairman, and I would just like to start by saying that starting on March 16th, yesterday at 8 o'clock a.m., we met with, pulled the county department heads in together. A few of those, the health director, Mr. Warren Cabe, our emergency services director, and social services, all those that have a primary role in this epidemic and how we, or pandemic, excuse me, and how we're addressing it in Macon County. Many of you may or may not be aware some of the closures and delays that have taken place as a result of this. Just to hit those, Mr. Chairman, the Robert C. Carpenter Community Building was closed yesterday, March 16th, and it will reopen no earlier than Wednesday, April 1st, 2020. Macon County Senior Services, and Patrick is coming. He can certainly speak more to this if need be. All senior center activities are canceled until further notice. The Community Resource Center, which is located inside the Macon County Senior Services Building, has been shut down as well. Regular scheduling practices regarding congregate meals remain in place. The seniors that are participants at the Senior Center are aware of the congregate meals and how they go about scheduling those. So those will remain in place. The practice of serving the congregate meals will be handled differently. And again, they can call those participants that are aware, and they already know, to call the Senior Services Center with more details. Macon County Public Libraries in Franklin, Highlands, and Nantahala are closed effective today, Tuesday, March 17th, 2020, and they will reopen no earlier than Monday, March 31st, 2020. Moving right along into today, Warren will be mentioning some closures relevant to his department. Veterans Services, he'll hit on that as well, and steps we're taking there. Biz Week, as many of you probably have not heard, this just came out a few minutes ago. Following the CDC's recommendation to postpone gatherings of 50 or more for the next 8 weeks, the Economic Development Commission has decided to cancel Biz Week 2020, which was originally scheduled for April 20th through April 24th. Macon County Public Health, in their press release, and we have the health director here, on March 16th, 2020, they notified the public that all non-essential services will be limited in order to allow staff to better focus on the addressing of the COVID-19 epidemic. Our maintenance department, maintenance notified me today that we have, beginning a month and a half ago, maintenance saw this coming down the pipe. We began ordering cleaning supplies and stocking cleaning supplies. We now have enough supplies on hand that we feel like we can sustain for 3 months with those cleaning supplies. And I was also notified today that some of the purchasing lanes for these supplies are now opening back up. So that is some good news there. The county has secured a reliable source also for hand sanitizers. We emailed departments today asking them to place their individual hand sanitizer orders, and we'll get those and try to get those back into operation in the county facilities as soon as possible. Following closures at the Macon Early College, SEC, public libraries, the Robert C. Carpenter building, our Parker Meadows, the restroom facilities will be closed, and limited activities at the senior center. We have been able to take the maintenance employees that were at these locations and put them along with staff in our buildings that are currently remaining open to assist in enhanced cleaning and sanitizing efforts. Maintenance has ordered a fogger machine that is expected to arrive on Friday, March 20th, 2020. What this fogger machine is it sprays a sanitizing mist. It is capable of sanitizing a whole room very quickly. We feel like this will lead to an increased efficiency in our cleaning and sanitizing practices, as well as more effectiveness in those practices. Department heads, we sent an email yesterday to department heads, and they are currently assessing the staff that are determined to be at high risk for complications associated with COVID-19, as well as staff who are presented with child care issues resulting from the closure of Macon County schools. We wanted to get those identified. Department heads are working with us to do that. Those high-risk employees include employees over 60 years of age, along with employees who have underlying health conditions such as cardiovascular disease, lung disease, and diabetes. As of 5 o'clock today, we will have identified each of these individuals in these target groups that I mentioned, as well as their capabilities to work from home. They're currently working with IT and will continue working with IT to make sure we have the infrastructure in place to allow them to do that. Administration will be participating in a webinar offered by the North Carolina School of Government tomorrow morning, where we're anticipating gathering further guidance on how leave and leave reporting associated with the COVID-19 pandemic should be addressed. All information gained as a result of this webinar will be used as we employ these work-from-home practices for these high-risk groups or those that are presented with problems related to child care. So we will be passing that information along and using that information as we move forward. Blue Cross Blue Shield, we have amended our health insurance plan. Blue Cross and Blue Shield offered us a amendment to the plan that waives all costs, including copays and deductibles, for initial testing, as well as any ongoing treatment for any employee who tests positive for COVID-19 or is taking a COVID-19 test. So as of today, that has been signed and submitted, and that is an active part of our health insurance plan here in Macon County. The sheriff is here today, and he can certainly speak more to this, but I know that he and his staff, even today, are working hand in hand with our contract doctor and nurse to implement protective measures inside of our detention center. With regards to the county buildings and those that I have not mentioned, we have identified, we feel like that through identifying and accommodating those employees who are at the highest risk of complications from COVID-19, along with the enhanced sanitation and cleaning efforts that have been brought about through maintenance, whether it be the increased staffing, the supplies, the new machine that we are getting that will help us with this, and along with observing the CDC recommendations that include the social distancing, frequent hand washing, covering of mouths and noses when coughing or sneezing, we're going to attempt to leave the majority of these offices open for business as we realize how important this is to our local economy. In many service-intensive offices, as you are well aware that visit and those that frequent our county buildings, such as the mapping department, the health department, tax office, we have glass barriers, windows, if you will, that separate the public from staff. Maintenance is currently working as we speak with our building inspections and environmental health to set up some barriers, like a plexiglass barriers, to prevent, again, or to keep that separation between the public and staff members. Another office that we'll be working with to accomplish this is in the Register of Deeds. And we recognize that while in the past it has been common practice to allow the public, to freely enter these office spaces, whether they're asking a question or sitting down to have a conversation with the employees, we would ask that for now that everyone recognize that this will be limited, and we will be asking the public to have all communications by the phone, via email, or again in observing these protective barriers that are going to go in place. And that is being done out of an abundance of caution to protect both the county employees and the public that are coming to get these services. We realize that it is important as these services continue to keep our staff healthy. I think out of all the things as county manager, whether it be a budget, whether it be a project, building a recreation facility, my greatest priority, as I know yours, as this board is to protect the health and safety of these county employees. And I think that these measures and steps that have been taken across the board, organization-wide, are going to do just that. And we have to keep on trucking, but we have to be aware, and we have to get through this as best we can. And together we are going to get through this. And Mr. Chairman, that is all the updates I have. Again, we have the health director, the superintendent, DSS director, the sheriff, our emergency services director that can certainly go into more detail specifically related to each of those departments. But at this standpoint, I'm very pleased with the way that we have been able to come together and quickly implement these measures to protect the citizens of this county and the county employees.
Thank you, Mr. Manager, and I agree. I've been, speaking to you, I think 20 times a day the last 3 or 4 days, just helping to ensure that everything's going smoothly. And I can't thank you and our county staff enough for the extra efforts that are being made and the knowledge and research that's going into ensuring that we are headed in the correct direction. Do you have a preference or an order of who would like to speak first?
It's up to you, Mr. Chairman.
Health Director, Mr. Carmen Rocco. Dr. Carmen.
Thank you and good afternoon. This is an unprecedented time, as we've already mentioned, with respect to a pandemic that was 6 months ago not really on the radar. And for the past several months, we've spent a great deal of time preparing with our partners, many of which are in the room today. And want to thank the county manager and the commissioners, Board of Health, and all the folks in the county departments that have helped support this effort from the very beginning and through this point now, that we are undertaking a great effort to protect the public's health. And we need to stress this is not a job that's done by one department. It's done by a multitude, and it's also done with the cooperation of the public. Just today, the governor has issued an order closing all restaurants and bars to in-house service so that only delivery and takeout will be provided as a means of preventing the spread. This disease is spread by contact from person to person. So anything that we are doing and any orders that are being given with respect to restrictions are based on the fact of how this disease is transmitted from person to person. It is also possible to transmit COVID-19 through contacting a surface that has been infected by an individual. This is a germ that stays on a surface and can live there for several days, and that's why cleaning is so important and using common sense hygiene practices is critical. So washing our hands is our best defense. Staying calm is also recommended. And I know working with lots of different people, everybody reacts differently to the unknown. There are still things that are unknown about this disease, but we are making great strides to learn as much as we can, as quick as we can. Information changes every day, and we are kept up to date through the state's communication with us on a regular basis. Just today, we had an hour call with the state to hear more about what's going on with COVID-19 in North Carolina. I would say that information and communication will be a key to preventing this problem from getting further into our community, and also help to respond to people with facts instead of rumor and fear. I would ask the community at large to please check with reputable medical providers before you take what you may have heard as the truth about a situation. So far in Macon County, we have had an individual who is not a resident of our state come to Macon County after being tested in Buncombe County, and then this Sunday we were notified that that person tested presumptively positive for COVID-19. Now, we are providing a good bit of information on Facebook. We are also seeing some responses on Facebook from the community. And let me assure you, as the health director, that we did not know this individual was coming here until after they arrived. The guidance is for anybody who is suspected of being infected is to go home and to be isolated until you're told that you are free to leave your residence. All I can say is that information, I believe, was passed on to the individual. Macon County is their home, the closest one they have to be able to get to, and that's why they came here. I don't believe there was any malice or intent to spread this disease to anybody, and they have been very cooperative with us since they arrived on Friday, March 13th. We will continue to work with them and follow their progress. The state knows what we're doing. We have been reaching out to the medical community on a regular basis with guidance that the state provides, mostly from the CDC. We've been working closely with the 2 hospitals in the county and the providers in the county to keep them informed and to try to do as much as we can to prevent this disease from spreading into the community. We have initiated drive-through testing at the health department, and up to date we have done, as of the end of this day, will be 32 tests. Of those 32 tests so far, 5 have come back negative. The balance are pending. And we will know that as the days progress.
We started that today, Clement, I'm sorry.
No, we started at yesterday, drive-through testing.
Carmela, can we go back to the person who's infected? Do we know her route from Macon County to Highlands and who she might have contacted in between?
We don't have much more information than what we were told by the individual, so it was limited. They used a rental, much like an Uber or Lyft situation, and that's how they got here. My understanding is they came directly here, and that their exposure to others was very limited. And since they've been here, they've been secluded in their home. Their home is such that nobody else is living there at the time. So there's only one individual there.
Well, the reason for the question, and that I know the chairman and myself are getting, is the rumor, to try to dispel the rumor that they went shop Franklin, and so we really don't know.
Let me say this, they made alternative plans to have somebody else shop for them.
Good.
And were very considerate of not wanting to be out of their residence. I think they understand fully the severity of this situation, and we expect that we will not have any issue. We have issued an isolation order to that individual, and there are remedies that we could take legally if they violate the isolation order. But at this point, we've had full cooperation from the individual, and they seem to be in fair health, and hopefully will resolve soon. And the incubation period and the period of disease are usually anywhere from 2 to 14 days, 14 days being usually when an individual will be, once they're exposed, will have that kind of result of a flu-like illness for that period of time. But as I was saying, the drive-through clinic is, or drive-through screening, is for us to be able to get individuals into the health department parking lot without exposing too many individuals and without having, bless you, the inside of the building exposed, so that there's an ability to have less risk for everybody. We are using a call center approach, which is a number that is staffed from 8 to 5, Monday through Friday, and we may change that depending on need. Our volume of calls increased dramatically yesterday once the media release was provided. The call center number is 828-349-2517. Again, that's 828-349-2517. And we're asking people who think they may either have been exposed or might be ill to call that number. And we will arrange for testing if need be, or consultation with them as the situation warrants. Right now, for the most part, the guidance for testing is that if you have fever, usually it's 100.4 or greater, signs and symptoms of lower respiratory illness, which is cough and shortness of breath, and a negative influenza test, and no other more likely diagnosis. Those are the folks that we are focusing in with our testing. Again, we ask that the medical providers use their medical discretion when making referrals for testing or testing on their own. There are tests available through private physicians, the hospital, urgent care. Those tests are available. But again, we're trying to minimize exposure, so we would encourage anybody who thinks they need to be tested or has these symptoms to contact their medical provider before leaving the house, before going anywhere, so that medical providers, including the health department, are well aware that we're expecting you to come and when you might be arriving. We don't want to expose individuals needlessly to this disease. Again, I would just emphasize the prevention aspect of what we're doing. The reason places are being closed and the number of people in crowds or in groups being limited is to reduce the likelihood of exposure to one another. This doesn't mean that if we close a restaurant or close a bar or close schools that we want to see people go out into larger groups in a social setting. This will defeat the primary purpose of social distancing. Social distancing is a technique that's probably one of the most dramatic ones to deal with because isolating people takes a toll and also interrupts your daily activities. But for the most part, we're trying to separate individuals so that people do not come into contact with one another. Close contact means if you become closer to an individual than 6 feet, and that individual is symptomatic, that you may be able to pick up that disease through that close contact, especially if you're in close contact for more than 10 minutes or longer. So if you prevent the close contact and the crowding of individuals in the community, you will reduce the likelihood of spread, which is what we're trying to interrupt right now. That's why even things as important as church services are being discouraged. And unfortunately, that has to happen in order to be effective. But what has been amazing to see is the creativity of people to look at using technology as a way to communicate, to provide information for groups like the school system, to provide food and teaching opportunities, MPP and others, churches live streaming. These are the ways that we need to be creative to overcome these problems for the time being. We don't know how long this will last. It could be many months, but it will be a historic event, and it will be one that many of us will look back at and be proud on how we reacted and learn from what we've done to make it better than it was before. And I am convinced that this county has a lot of strength to be able to handle the situation in a positive way and to prevent the spread. What I ask is people to be cooperative, to be patient, and to seek out the information without responding to rumor and fear first, but to find out the truth before you make a decision on what you're going to do and how you might respond. I do believe people want to protect their families. Those folks who are 60 and over are at greatest risk if they become ill of complications. They are not at greatest risk of becoming ill, but once they do become ill, they do have a greater risk of complications. Individuals who are under 60 who have underlying health disease or complications due to immunocompromised situations like cancer, heart disease, lung disease, diabetes are at risk. So we want people to use their common sense and to approach this in a way that consider your neighbors and your community your family. If you don't want to pass it on to your family, then do what's right. Stay at home and practice good common hygiene practices. And we will get through this as quickly as possible, but we need to understand it's going to take some time.
Carmen, can you walk us through what our workers at the health department, what protections they're taking and what avenues they're doing to protect themselves? Is they do these tests or whatever they need to do?
When the health department has been trained in using protection with environmental concerns and exposure, it's called PPE, personal protective equipment. So that can include a mask, face shield, a self-enclosed hood that has air filtration, a gown, gloves, shoe covers. All these pieces of equipment will prevent contact directly by COVID-19. So if somebody should sneeze or cough, that is the protection that they'll have. And for the most part, it will protect them most of the time. They still have to use common sense and hygiene practices. The testing for the COVID-19 is involving a swab that is inserted into a nasal passage, and then a swab that's inserted into the throat. And that's put into a container, and that medium in the container keeps the virus alive until it's tested, and that gets tested at a state lab. There are other labs that test for COVID-19. LabCorp is another one that's available, and so is Quest. So there are commercial labs that are able to test for this disease, and we also have the state lab that's providing testing kits to mostly health departments at this point. So we are protected. We look at a buddy system where somebody gets gowned up. The person will watch the individual to make sure they don't slip or have a exposure unintentionally. And then we use that in the clinic depending on the circumstances. We also have a room that's being filtered continuously so that we can bring a person in there. But we're trying again not to put others at risk by bringing individuals into a room or into a building, because it takes roughly 2 hours for that room to clear once that air has been exposed to the COVID-19.
And how many tests do we have?
We have just a few right now. We've ordered more. We're expecting many more, 30 plus tests very soon. But like I said, we've done over 32 tests by the end of the day. 5 of the tests that have come back are negative. We will continue to test based on need and the criteria that the CDC and the state has given us to test. We do believe that we're responding as quick as we can, but that's what the call center is for, and we will make arrangements with individuals to test them just as soon as we can. We're trying to keep our supply of tests and the demand in balance. But sometimes it outstrips the supply, but we're doing well, all things considered.
Any further questions? Carmen, on behalf of this board and our county, please thank your team at the health department for
Yes, sir.
their important and diligent efforts. Thank you.
Thank you very much. We've had a good team and a lot of good people to work with, not only in the department, but working as partners in the community. So thank you very much.
You be in the first line of defense, Carmen. Should you need anything, I believe this gentleman to my right will be more than happy to accommodate you.
Just pass the hand sanitizer around.
We ain't got none.
Well, that's not good to hear. Okay, thank you very much.
All right, Mr. Warren Cave, our Emergency Services Director.
Thank you, Mr. Chairman. I want to reiterate a few of the things that Carmen had talked about. And last week, I was hopeful that this thing would take a different turn on the curve of where we're going with this, and unfortunately, it has not. It's exponentially went a different direction. And one of the things I want to reiterate to y'all, and I'm sure Carmen will back me up, and he probably has better numbers than me, but for 80+% of these folks that may get this, the symptoms are very, very minor, and recovery would be very quickly after that. For the other 20 or so odd percent, obviously there's some underlying medical issues there that come into play that make this much more serious. And that's particularly the population that we're concerned about. But with the same token, we've had several discussions this week on the economy and the part that we play in the economy as the county, and how we want to make sure people keep working and we keep the everything working and moving as much as we can over the next weeks to months or wherever. So you can imagine even if half or more of your workforce had a very minor illness for a day or 2 or 3, what that does to businesses and to organizations in general. So the spread is here. We were very unfortunate to have one of the first, not necessarily on the map cases, but to be brought to the attention of everybody else a vacation in Western North Carolina, but we knew it was coming. And we're not going to be the only county, and it won't be the last one. I can almost promise you that somebody you know or somebody that's in your family will be exposed to this in some form or fashion in the next month to 2 months or longer. So essentially what we're trying to do is with the things we're recommending, the things the governor's recommending as far as mass gatherings, some of the restrictions that are taking place is to lower that curve of the people that are affected by this, and to perhaps keep some of those folks out of our medical facilities, so we don't have a rush on whether it's public health or physicians' offices or your medical facilities, or have a rash of folks that all of a sudden can't work for a period of 7 days and everything has to grind to a halt. So a lot of the things we're doing is to flatten that curve and keep more people viable and productive until we get through this and kind of see light at the end of the tunnel. A couple of things that we're doing on our end, we talked about building closures. The Barrett building, as of 8 o'clock in the morning, we're going to close to public access. Obviously that affects some of our agencies, but veteran services. But we found some ways to make that work without actually having the public coming into the lobby, whether it's through email or phone calls or some other method. But one of the things we have to be very careful of is that's our emergency operations center for the county, and all of our 911 communications filter through that building. So one of the things that we absolutely cannot have at the moment is have 50% of that staff all of a sudden ill and unable to produce. We actually have some contingency plans in place. We've looked at losing up to 40% of our workforce, and we have some contingency plans in place both for 911 and EMS to still maintain the level of service that we currently have with a 40% reduction in our workforce. So it would take a considerable chunk of our staff to be out before we started to see a detriment in the level of service we could actually provide. We're actually also we're changing the way that we do business, just as Carmen has talked about. Some of the things that we're doing is on particular pre-hospital calls when we respond to a patient that could have symptoms, we don't expose the entire ambulance crew to that patient at one time. We may send one person in and have one person wait until we kind of figure out what the circumstances are. If there's any doubt, we will not send fire department personnel to limit the number of folks that could be exposed in a community. And really what we're trying to do is prevent that community spread of a disease somewhere, and it may be there somewhere already and we don't know, but we're trying to limit that. So we're taking some precautions, and we're also going to take we've changed the way we do business with EMS. Typically, if you wanted to go to a medical facility, we would pretty well take you about any time, anywhere you wanted to go, but we've become a little bit more forceful and a little bit more operative with the processes we do to try and maintain that treatment at home. Because if you have a minor illness related to COVID-19, one of the last places you want to be, if we can help it, is tying up an ER bed or another medical facility bed, because this is not the only thing going on right now. The person that needs that facility space may be a more serious patient with COVID-19 symptoms, or it could be a completely different illness that we still deal with on a daily basis that haven't stopped coming. So we've changed a few of those ways that we do business. I think you'll probably see more of that. On your desk there, I've recommended a state of emergency for Macon County. You also already have one that the town of Franklin has just signed, and the town of Highlands is actually going to undertake one, I believe, at 4 o'clock today. Usually those states of emergency are declared when you think that the resources you have in the county are going to be overwhelmed, and we're not to that point yet. We're stretched. We're really stretched, and have been for a day or two, and it's not looking any better for a couple of days. But more importantly, we want to be prepared for that if that does happen. But we also know that there's some funding. There's a national emergency declaration. There's a state emergency declaration. And for any of the funding that might come along for that, whether it's for emergency protective measures, or any of the other actions that we undertake, the funds that we have to spend, usually one of the requirements to be eligible for that reimbursement is you have to have that state of emergency in place. So I think it's prudent that we undertake that today. We also referenced a couple of things in there. We referenced the price gouging. We're not going to tolerate somebody taking advantage of a situation and creating some issues with folks unnecessarily. And there's also a reiteration of the governor's executive order there as far as prohibiting mass gatherings of more than 100. One of the questions that came up, CDC recommends 50, which Carmen mentioned a little earlier there. Governor still at this point has it 100 or more, and even in his latest briefing at 2 o'clock today, it was specifically stated it would remain at 100 or more. One of the things that I need to inform you of is that's a very fluid situation. In the event that that changes with an executive order with the governor, we need to make our changes appropriately locally to match that. I'm not a big fan of not having consistent stuff across different agencies, so we certainly do need to match that. So even though we address this today, this may not be the last time we address that. The other thing that the folks need to realize, we obviously won't be able to remain calm. Grocery stores are going to remain open. Gas stations are going to remain open. Some businesses are closing for precautionary reasons. They may be closing because it's not worthwhile for them to do business economically at the moment till we kind of get over this. And some of them are doing it out of an abundance of caution, which is an appropriate thing to help us do what we need to do. But obviously there's certain things that have to remain open and will remain open. And we will, even in the things that you'll see in the news, and I've almost got to the point where I don't even like to watch the news. In the news you see 24-hour curfews, and that sounds really bad, and it's certainly not convenient, and it's not something that we're accustomed to here. But even with those folks, they're allowed to go get their supplies and go get the things that they really need. So it's when you hear that process going on there, we're not to that point. And it's a lot of the rumors out there that we try and dispel over social media and other avenues. We're going to make sure people are taken care of to the best of our ability. The one word of caution I should throw out there is we mentioned the 100 or more folks. CDC recommends 50, and that doesn't mean that you take 99 of your friends and go somewhere and you're okay, and when you get to 100, that's the tipping point. Any large group, even the president referenced 10 yesterday. There's a chance at some point you're going to come in contact with somebody that could be an issue for you. But some voluntary compliance on the organizations and the groups that are in Macon County abiding by that 100 number, heeding that 50 number, even thinking real seriously about that 10 number will prohibit us or prevent us from getting to the point where we're the ones that have to say we're going to limit it to 50, or we're going to limit it to 25, or we're going to limit it to 10. So I would encourage the public to heed those recommendations before it becomes an issue where we have to step in and make some changes with that. With that being said, I think I still have Tom Neal with Highlands Cashers Hospital and Karen Gorby with Angel Medical Center on the conference call on my cell phone there. So I don't know if y'all have any questions for me or for them while we're here.
The question I have, Warren, is I know that you have the ability, the school has the ability on the emergency phone line to contact folks. For those folks who I know the media is doing a good job, the radio station, local radio station, and local media, but those who don't have access to internet service, has any consideration being given about giving everyone an update through that system?
One of the things that I was actually talking to Robbie about when we came in here was to perhaps use our reverse 911 system after this meeting to reiterate the state of emergency and some of the things that are going on to try and get the message out to folks that way. But we will certainly work with the public information process, and that's been really ongoing steadily with public health since this past weekend. We will do everything possible to try and make sure that message gets out to the public. One of the things that we did as an agency yesterday, the governor's executive order over mass gatherings, we actually visited the locations that we were aware of that might affect to make sure they were aware of it, to make sure there were no issues of them not getting that information. And we intend to do that same process with the restaurant executive order.
Is there anything that either one of our hospitals need from this board, from the county at this time?
Tom or Karen, can you still hear me?
Yes, and I really appreciate the proactive approach of our county, the health department, and EMS services. And I know Tom can add as well that the hospital hospital is prepared for an onslaught of patients. As you're probably already aware, we have secured all of our entrances and are screening all of our patients as they come in. We have just tightened down our visiting policy that if we have anyone who is screened positive, we will not allow them to visit except in extenuating circumstances. We are in collaboration with, the CDC, the federal government, the state government, as well as HCA and Mission Health, and have been given a lot of information to help educate our staff and our patients as we see patients who potentially are screened for the COVID virus. And, we continue to plan so we can be ready for the surge. Here at Angel Medical Center, every department has a surge plan for the department. We have beds, we have space, we have equipment, and we have supplies to take care of patients that surge. And we also are currently working on an alternative screening site, and we can give you more information when we got that up and running. We're working on also some other ways to screen patients, as far as if it's through the internet or through telemedicine. And I think the one thing that we have to make sure that patients are clear on is that they need a physician order to get tested for the COVID-19. And we do the same process that the health department does, is screen them for flu first and then send the specimen to get taken for the COVID-19. We're encouraging our staff, if they're not feeling well, to stay home. And we've also postponed any large gatherings and closed our cafeteria to just our patients and our staff. So, Tom, you want to add anything else? And then if you have questions.
Yeah, sure. Thanks, Karen, and thanks for the question. First, I would just want to say that our primary objective during this has been to make sure that our staff and our patients are safe. Everything we've done has been focused on that effort so that we can continue to support the community should this actually increase. The one thing I think I'll just add to Karen, points of access to both the hospital and the Eckerd Living Center have been limited to one entrance. We do have screeners in place at those. And to Karen's point, if you are a visitor coming to our hospital and you have any of the risk factors, we are not allowing you into the hospital. With the enhanced visitation Karen also mentioned too, we are only allowing one visitor in that is negative for the symptoms, which, again, going back to Carmen's fever, cough, travel history, and we've limited that from 6 a.m. to 8 p.m. Cafeteria is also restricted here. Other things I'd point out, volunteers, we are no longer allowing volunteers to the hospital. That is something that we've looked at to make sure we're keeping the area safe. A big thing we've looked at is our access to personal protective equipment, or PPE. We are adequately staffed to make sure we're taking care of our employees if we would need to. Karen mentioned the postponement. We are also, and I would encourage the county to look at this, but we have discouraged our colleagues from travel outside of the U.S. and our areas that have been identified which is high risk for the virus, which at this point I'm not sure there's a place that would be considered such. The other thing I'll just mention that the HCA has been very supportive doing this. We have set up our emergency operations center. We are continuously looking at what are our needs to make sure that we have the support to get those. We have also looked at our search capability at Highlands, and we are prepared should we have an additional need for patients to take care of those. And I'll leave the same, if there's questions for what we're doing. But again, I'll leave with the same comment. Our goal is to keep our patients, our staff safe, so we can continue to support this community.
And again, I think the message we want to get out to the public is we want you to be concerned. We're optimistic that we're going to come out of this as good as we can, but we certainly want to bring the concerns to you all and to the public, and to highly recommend that you heed the recommendations from the appropriate agencies, whether that's our local public health or Center for Disease Controls, and find the right information from the right people to make sure that you pay attention to those.
Karen and Tom, this is Ronnie Beal. Thank you for being part of this very important discussion for the folks today. I do have 2 or 3 questions. number one, how many doctors do you have on staff at this time, combining both hospitals?
I'll speak for Highlands if you want on that. The first one to add to Warren's comment, and I think this is important, information that needs to be coming out about this virus. You know, we have been directing everybody back to the health department. You know, that I appreciate Carmen's leadership. They put a press release out about this resident. So just really want to encourage that everyone, and I've had the same conversation with our hospital staff, you know, you may have access to information. You are not the venue to get that information out to the public. So that's just really important, I think, for everybody. As far as the medical staff, we have adequate medical staff to address the needs. On the inpatient side, we're primarily driven by a hospitalist model. So we have one hospitalist that is covering the inpatient side. And then we have obviously the ER where we have a physician on site to manage the ER, and that's 24/7 on the emergency department. The clinics, you know, we are monitoring the clinic schedule to make sure we're meeting those needs. We are actively looking at telemedicine options to help meet any increased demand. And I think that's important for two reasons. One is that we do anticipate there will be increased demand for people wanting to see a doctor. It also limits the exposure and the risk that we might have a spread of the infection. So we do have the resources to do that. We have not stood it up yet, but that is something that we do have that we could use if we needed.
And I can speak for Angel, just similar to what Tom said. You know, we're covered by a hospitalist model here, and our ED physicians are part of the Mission Health Group, as well as our providers are part of our, we call the PSG group. And so we have quite a few physicians credentialed here and can pull them in to help us, as well as community partners.
And how many beds are available in Franklin?
How many beds at Angel?
Yes.
Okay, so based on the recent waiver by the federal government, we can exceed our 25 critical access licensed beds, and we are setting up to surge into the 30s for inpatient, because you realize we have some additional space here that might not be in other hospitals. So our surge plan is part of each department then has to surge up to care for this patient. So that's the inpatient, and then we're looking at outpatient care as well.
And we've had
We have the capability to bring up to our full capacity of 24. We have 8 additional beds that we can bring online to support a surge. We're currently running a census of just shy of 10. So that would give us the capacity to handle roughly another 15 to 20 patients.
We've also had several questions about, you've heard the discussion about lack of equipment. How many ventilators do we have in the county?
I'll take the first if you want, Aaron. Our plan for ventilators, we do have one ventilator on site. We do not have an ICU at Highlands Captures Hospital, and we have no plans of actually standing up an ICU. This is an area where we're really partnering with Mission Maine, and they have done a lot at Mission Maine to increase their capacity. I know they've just purchased an additional, I want to say, 20 to 30 ventilators to help support the needs. So that is really our avenue for making sure we can adequately take care of ventilators at the Highlands Center. There is a lot more involved with bringing ventilator patients into the hospital than just having business.
And so at Angel, we have 5 ventilators, but we can also use our anesthesia machines if we need to. And as Tom alluded, they're putting together a cache of supplies and equipment through Mission Health that we can have access to.
We actually have one of the, what you call a ventilator, which meets their requirements. That's an advanced system that we use to do transports from inter-facility locations. We have other means of maintaining, but for your definition of what you're calling for a ventilator, we actually have one that matches their criteria.
And Karen, how many quarantine beds? When I say quarantine, like ICU beds, I don't know if that would qualify as a quarantine bed, but let's say you have 3 patients that test positive that come to the hospital and they have to be admitted. how would you handle that exactly, on the ICU units, or where would you put those patients?
So right now, those patients all go in a single room. We do have negative pressure rooms, but since the standard has changed that we don't have to worry about airborne containment, or not containment, but airborne contamination, we don't have to put them in a negative pressure room. So we actually have 9 ICU beds. We can add another 8 step-down patients, and then with surge, then we have another 9 current beds, and an additional then 14 beds. So since we're all private room, we can isolate those patients and then use the precautions outlined by the CDC.
Thank you.
Any further questions? Thank you both.
Thank you.
All right, Warren, just from past experience, I have the utmost confidence in you and our team at Emergency Medical Services, so please thank them for their efforts as well. I appreciate your update.
How many ambulances, Warren, have you got on the line?
At any given time during the day, we run 5 crews. We have 3 in Franklin, 1 in Highlands, 1 in Nantahala. We have a supervisor on a QRV. During the daytime, we bump up to another QRV so we can generate the 6th ambulance with the 2 people on the QRV during the weekday hours. And we also use our fire services crew. We have a paramedic on each one of those shifts on our fire services crew that we could generate a 7th if necessary, or they fill in and generate the 6th one depending on what the circumstances are. And we've actually, one of the things we've actually changed is some of our calls, particularly here in Franklin, where we have the ability to send the QRV or the community paramedic, depending on the severity of the original call, depending on the symptoms, we are set up to address those with one person with the QRV instead of actually tying up an entire ambulance and having to worry with decontamination and tying that up for other means.
And if you have to, we could set up, I recall the flood that night when we moved everybody out of Macon Valley, and to set up a quarantine area. Let's say the hospitals, you can't take it, the Mission's full, Franklin's full, worst case scenario. We could set up like the Carpenter Building, the Guard Armory, even a school gym, or.
Right, there's some provisions in place. There's a big difference between isolation and quarantine. There's some legal differences between the term of those, but we do have the ability to establish a quarantine area. The biggest difference for common terms, isolation is somebody stays by themselves somewhere else. Quarantine, you get a little more involved with you make them stay there and nobody else goes in and out, and you kind of have a little more control over the area. But we have the ability to do that if necessary. I don't think we're not there yet. One of the other things to your question, the 5 ambulance crews that we run, for every frontline truck that we have with a crew staffing it, we have a spare either sitting beside it or behind it. And we do that because places like Highlands and Nantahala, where I have 1 ambulance crew, if they were to step out to the ambulance bay and go to crank the ambulance and it doesn't crank, they can't wait 45 minutes for me to get them a backup one from here to Nantahala. So we keep a spare in each of those locations, and we keep basically 2 spares in Franklin to cover the 3 frontline trucks, and then we have a system spare so that if we bump a truck out of service, put a spare in service, the system spare goes and backfills. So we have a rotation system to keep a minimum number of available trucks, staffed or unstaffed, in each of those locations.
Have you saw your calls ramped up already?
Actually, our volume has not increased dramatically for this. And you'll see some stuff in our budget presentations. We've had a pretty significant increase from last year to this year, but nothing that I can really tie back to this at the moment.
We hope it stays that way.
Good job, Warren. Thank you.
Thank you, Warren.
Thank you, Warren.
Mr. Patrick Betancourt, Director of Social Services.
Gentlemen, I don't mean to be rude, but I didn't know we were going to have this meeting until yesterday. I've got another commitment at 4:15. I support the chairman and whatever decision he makes on this state of emergency, and thank y'all for what you're doing. We'll come through this.
Thank you, Paul.
Thank you, Mr. Chairman, Commissioners. I apologize for being late to the meeting. I'm not sure what the county manager already gave you in terms of information regarding Department of Social Services. I'll focus on the senior center first. Obviously, that's the population that's most at risk. At this time, we've closed the Senior Services Center to all activities other than our adult day program as well as our congregate meal, though we have shifted the way in which we deliver congregate meals. I'll talk about that in just a second. We've closed our walk-in Community Resource Center, but our telephone option for Community Resource Center remains open. Currently in our adult day program, we are doing daily screens of everyone who comes into the adult day programming. We are screening both the participant as well as the caregiver who comes in. We've also closed that off to anyone other than the participant and the caregiver who's assigned to get the participant out of the program. So there aren't any volunteers coming into the Senior Services Center. Starting today, we shifted over our congregate meals from a sit-down meal setting to a vehicle-delivered system. I have to thank the staff at the Senior Services Center for pulling this together so quickly, and we got approval from AAA to be able to move to this model. So starting today, of course, today being the most difficult day because it was not only our first, but it was in the rain. So if you're going to do something on a first time, might as well get over the hard part, and the rain helped us do that. So we were able to serve the 25 meals for a Tuesday, which is a little bit under than what we would normally serve. We normally serve about 35 meals this time of year on Tuesdays. It's not a bingo day, so that helped to reduce the numbers. But we thought that was a pretty good showing for the very first day. In talking with Jennifer Hollifield, the administrator over at Senior Services, it was a flawless system. They were able to get folks in, get them out. We exited the folks off the property through the old building next door, the stoplight. Thank you. The Chamber of Commerce building. The stoplight still functions there. Special thanks to the maintenance department for helping us get the cones set up and being able to route traffic. So it worked out really well. For our home delivered meals, we have shifted over to a ring and drop system only, where the volunteer delivers, rings the doorbell to let the individual know that the meal's there, but tries to limit any contact with the individual. We do try to have that visual contact, but keeping that social distancing in mind. In terms of the Department of Social Services, for the most part, it is business as usual there. I would like to take this opportunity to request that anyone who has information to deliver to their caseworker, if they can utilize our drop box. We have a drop box out front, so if all you're doing is delivering information to your caseworker, we ask that you utilize that drop box and drop information off there, again, keeping the idea of social distancing in mind. If folks need to apply for either Medicaid or food and nutrition services, just want to remind the public that there is an online option to be able to make that happen. It's at www.epass.nc.gov. Online applications can be made, and for the most part, we can limit the amount of face-to-face contact that we have with individuals. Sure can. It's epass.nc.gov. EPASS. If the public has questions about their benefits, they can certainly reach out by calling their caseworker. We still have most of our staff online, and we anticipate that if we get a surge in applications for FNS or Medicaid, that we'll be able to respond to that. We have, per HR Director Mike Decker, we have begun compiling information for those folks who might be affected, whether it's based on age, child care arrangements, that sort of thing. We've begun compiling that information. We've also been looking at options of either work from home or some sort of shift work if it comes to that. I recognize that's not where we are at this point, but we feel like we need to make those plans now and be responsible if we need to go that route. That's all I have for DSS and senior services unless there's questions.
Patrick, on the meals being delivered, this is some of these folks, this is the only contact they have
Yes.
every day. So it's ring the bell. Are they going to have any verbal communication? Because if these folks need anything, that's usually their only line, and the volunteers, we just need to send a special thank you to them. But like if they need medicines, if they need groceries, will they communicate that to the delivery person, and we can, and there's a system in place for that. So
We are asking volunteers for those folks who do present as higher risk. We have folks that we're delivering meals to who we recognize really do depend on that day-to-day contact. We are asking the volunteers to somehow be able to check in, whether it's wait in their vehicle to see that the doorbell is answered. We are asking them to verify that that person is okay as much as possible. And certainly we have the ability to call them through. We have a program known as My Senior Center. It's an automated program. We have a way to reach out to them using that system as well.
good. Because that's the
Absolutely.
only contact, and a lot of people in the community don't know that. But
Absolutely
there's
right.
a lot of them.
Would
How
you-
many meals do you anticipate a month now, Patrick?
Well, on an average, we serve about 45 to 55 in congregate, depending on what day it is, on what activities are occurring in the center at that time. That'll obviously ramp up in the warmer weather, anywhere between 60 and 70 meals a day in congregate. So we hope that we will be able to do that through the drive-through delivery as well.
Wonderful program, great people.
You add that up per month, it's a lot.
Yeah.
A huge majority of that by volunteers. So,
It is a large push through our volunteer
really
pool.
unbelievable what y'all
Do
do.
you need anything, Patrick?
At this time, we don't.
Thank you,
Thank
glad
you,
you're
your
there.
team, please.
Thank you.
Thank all your staff.
Yes, sir. Dr. Ball, any comments,
Just,
any
we're
questions?
closed for 2 weeks to students. Faculty and staff are still working.
Come up here so I can get you on the radio.
Schools are closed for 2 weeks to students. Faculty and staff are working on optional work days. If they have leave, they can take leave, and we're offering work from home where we can to our employees, depending on the job description and whatever underlying health conditions they might have or child care issues. Today we delivered meals to 2,100 students, a little over 2,100 students. That's breakfast tomorrow and lunch today. We'll look at what went well today and make those corrections tomorrow. We expect that we'll probably deliver more meals tomorrow than we did today. We also began remote learning opportunities for students today. We'll be expanding that over the next few days. Principals and teachers met today. We're planning on, providing remote learning and meals beyond 2 weeks at this point. We're hoping that we won't have to go that route, but we are planning to be closed for an extended amount of time. I'd like to thank Warren and Carmen, all the county departments for their accessibility and their support throughout this event. They're always great. It's a scary time, but if you're going to face an issue like this, there's no better place to face it than Macon County.
Absolutely.
I agree.
You need anything? Mr. Supervisor?
Not right now. We've got a lot of staff working to put these meals on the buses and deliver them. We've had a lot of folks reach out to us, making Program for Progress, churches, businesses, and those sort of folks. And at this point, we're in good shape in terms of personnel, but that's subject to change. We'll reach out to those folks if we start needing
And I
bodies.
assume these folks are going to continue to be paid just as if schools are going on. Is that correct?
That's correct.
Good.
They're taking leave, sick leave, annual leave if they have it. In certain situations, we're able to let them work from home. We're encouraging and monitoring social distancing. That's difficult in a school setting, school employees, parents, but we're encouraging that. It's important that we stay healthy, that these folks stay healthy so we can continue to serve the community.
I believe your bus drivers and teacher assistants, they're still on the payroll, but they're doing the buses.
Yes, sir.
Taking the meals out.
The bus drivers obviously are driving the buses. The teacher assistants are heavily involved in preparing the meals. delivering those meals, making sure that they get to the correct location and getting in the child's hands.
So important.
I need to ask one other question. It'll pertain probably county and school. I've had calls about the county outdoor facilities. Can the public use them? And I know you have rules and regulations already on like middle school and those facilities. But where are we on the county, like Parker Meadows and things like that? I didn't know what to tell them. I told them we had a meeting today at 3, and I would ask.
We've been advised that community use of facilities is closed at this point, and that, I'm assuming that would extend to outdoor areas as well. I mean, that's not something that.
I'll reiterate part of that. We actually met with Seth and some of the rec park staff at the beginning of the week, and we obviously closed the community building. The rec facilities are basically closed. There's not going to be any maintenance of the ball fields and any of the management of that. I would highly recommend that we don't get to the point where we have to make some kind of enforcement measure to keep a certain number of people out of those areas, but we certainly recommend that you stay below those thresholds of, even though we say 100, 50, 10, we would highly recommend that folks don't go out and have those groups for the immediate future for those places.
But to entertain some of these kids, Mr. Superintendent, is the school playgrounds. I mean, most of them are accessible. So, I mean, I don't think you'll see 100 kids, but if a parent wants to take their child out to one of the school playgrounds, is that okay?
Well, state law changed a couple of years ago to remove the liability from the school system if folks use the school facilities after hours, playgrounds, and that sort of thing. You know, right now they're closed. Now, you know, we're not policing those areas, but that's about as good an answer as I can give you.
I think the principals felt good about closing everything off. Not having people having access and being mobile to come on and off the campuses.
Well, we're looking at as you know, the purpose is to limit exposure, and that's difficult in the school setting. It's difficult in the situation that we have right now with folks working, providing those meals, providing remote learning opportunities. You know, we're doing the best that we can with that.
Carmen, do you have something to add?
My friend. Thanks, sir.
Thank you, guys.
Thank you, Dr. Ball.
Dr. Baldwin's right on target. I think, especially since we're on the front end of this social distancing approach, with just having a few days into it, I know children will be antsy. The weather may get better and people want to get out and do things, but if we could give at least the next 2 weeks an opportunity to have some impact on distancing folks and keeping them separated for as long as we can while we're waiting to see how this blunts the spread, it would be helpful. And I know it's hard to do that in a difficult time of year, and cabin fever sets in, but we don't want COVID fever to set in its place. So I would just say if we could be creative and dust off the old games and fort games and use your imagination, but stay inside if at all possible. We have been reaching out to the faith community as well to encourage them to pass the word around as to what to do in this case. And of course, as I mentioned earlier, the churches are also being discouraged from having service. So I know it's hard, but we really would encourage people to give it a shot so that we can see if it works. We want to give ourselves the best chance to be successful and not have additional impositions of rules and regs on us.
Sheriff Holland?
Good afternoon. I'll try not to cough.
Cover up.
Yeah. First of all, thanks for allowing me to come and speak for just a minute. The county manager asked for me to give you an update on what we're doing. While we're concerned about everybody outside, we also have to be concerned about those who we have staying in our facility. We currently have 90 inmates. As you know, we have a 75-bed facility, so 15 of those are out of county. This week we've tried to take some measures to try to reduce our numbers just a little bit. And so we did have some people that were able to make bond for minor offenses, such as child support. Of course, some people don't think that's minor if it's their family that they're paying for, so I don't mean that with any disrespect. But we have people that were able to have their local sentences as served, so they were released. There were 5 bond modifications that were made. The inmates still can't make bond. And then there was one case that was actually dismissed. That was an individual that was having to be housed elsewhere for medical conditions, and he's in on misdemeanor charges. So that case was actually dismissed. And of course, we had a total of 3 child support. So that's now with 75 inmates here and 15 out of county. So you can see we were over 105 at one time this week. We have made the decision, the entryway to the detention center is closed to the public. There will be no access. There is a telephone that's there, placed at the entryway, where the person can come up. You come inside that first vestibule, and you get on the phone and you talk, and you'll talk to the person that's sitting behind the desk. We had people that were coming in, walking up to the counter, talking to, coughing, sneezing, and so in order to protect not only the community but the inmates as well and my staff, we made that decision. And so gun permits is a big thing. We've had since January, we've had over 500 gun permits or renewals. And so that's a lot of reason we have people coming in a whole lot. So working with our IT department, we've got it on our website to where now an individual, instead of coming in, they can actually go on the website, fill out their applications, make a copy of their driver's license, and submit that back to us by mail. And then when we receive that, we'll do what we have to do as part of our requirements, and then we'll contact those people back, and then we'll have a time where they can come in and be fingerprinted. I'll be honest with you, we're not going to do any fingerprints in the next 2 weeks because that's hands-on, and I'm sure that he would recommend us not be doing that, so we're not going to be doing that. Visitation at the detention center is a real concern. It might be easy for somebody to say, well, we just need to stop visitation. The problem is you don't have any benefits in the jail except visitation. You have nothing that can be taken away from you because you're already in jail. And so visitation is a big deal to the inmates. And I don't want to upset 105 inmates to tell them they're not going to have visitation. So again, working with our IT department, we're working on being able to use teleconferencing, which is something we've talked about for a long time. And so we're going to use teleconferencing on visitation. And in addition to that, I was called into a judge's chambers today requesting that we do the same thing for inmates that are incarcerated. Instead of us having to transport them to the jail, from the jail to the courthouse, the judge would prefer them to stay at the jail and not be in their courtroom. And so we're going to do the same thing with that. And so it's all going to be new. It's going to be trial and error, but we're going to work those things out. So that's in the process. And hopefully we'll have that set up within the next 24 hours. Bless you. There's a little misconception that courts are no longer in process. That is not accurate. The court system wants the public to know that we are still conducting court procedures, especially for those people that are incarcerated. They still have due process. And so there are things that are taking place within our court system. For instance, we have bond hearings, probable cause hearings, domestic violence situations. We can bring them case-by-case basis before the judge, and we're doing that. At this time, the only resource that we are not making available to the public is actually fingerprinting for the concealed handgun permits, as I earlier discussed, as well as applications for new employees with the school system or daycare or whatever. We're not doing any kind of fingerprinting at this time. The only exception to that service being provided is the inmates are not being provided the services outside of what they get with their court system. We're not doing any of the AA, none of the volunteer programs. We're not doing Prime for Life. We're not going to bring anybody from outside and put them into the jail facility and not only contaminate the inmates, but potentially contaminate that person coming in, as well as my staff. We too are encouraging our staff to stay home if they're not feeling well. They can work from home if it's available, if we're able to do that. We have meetings planned for our staff. Of course, we meet daily on our command staff, just as we do throughout the year. We're planning to, we're going to be having some discussions with our employees about leave time, any unnecessary leave. Of course, as a supervisor or department head, I'm very supportive of family coming first. So I understand that there may be some things that they need to do at home. They may have plans to be somewhere else, whether it's vacation or whatever. But we're going to have conversations about that and try to eliminate that as possible throughout the next 30 days. Right now, we're all hands on deck. I want to reiterate what everybody else has said. I appreciate the support of this board, finance, every department that is with the county. Makes me really proud to be a part of this county, and not only of what this county is doing, but as you all know, what so many in our community are stepping up and doing and offering to do for this county and for the people in this county. So it just makes me really proud to be a part of it and be associated with everybody that's involved. And that'll be it for me. If you have any
Sheriff and I had
questions.
this conversation, I'd like for him to share it with the board, that as his calls continue, the volume continues to go up, what the on-road deputies still got to answer these calls.
Correct.
And they still got to be there regardless. So tell the board, if you will, and those listening, Sheriff, what precautions you're giving to the road deputies.
Basically, we're taking the same precautions. I mean, I know this virus is a serious situation, but we deal with what we deal with out on the road and out in the community. There's all sorts of serious diseases that these officers are dealing with daily. So they're taking basically the same precautions that they always take. I can guarantee you they're washing their hands a lot more now. They're doing some things like disinfecting their vehicles after they transport somebody. They're communicating really well. If they have somebody they're concerned about, they're making sure they let each other know about it, and they're getting that information back to us, and we can get in contact with the appropriate agencies. Our agency is no different than any other agency with the county. They're working all hands on deck, and they're doing what the county expects them to do.
What do you need, Sheriff?
I don't need anything right now. I appreciate the support. I hope that support continues. We all will say we're going into the budget process, so we'd like to make sure we get some support in the budget process.
All right, thank you, Sheriff.
Thank you.
Thank you, Sheriff.
Let me ask Dr. Baldwin another question.
Sure, Dr. Baldwin.
And you may not want to elaborate on this, but the other day in our meeting, you talked about your feelings at this time regarding the end of school calendar and spring break. You want to elaborate on that, or?
I can tell you what I know at this point.
Right.
At this point, we have no plans to change the date for spring break. We have no plans to change the end date for school, still May the 21st. The primary reason for that is our folks are working, and we are providing some remote learning opportunities right now. We'll see how that goes as it moves forward. I know that we received an email yesterday from the state superintendent, Mark Johnson, and he's planning on additional remote learning opportunities after this 2-week closure comes to an end.
Thank you. Thank you.
Mr. Chairman, real quickly, if I could, while Warren mentioned the state of emergency and the fact that that opens us up to receive funding from federal and state sources, should that become necessary, we, at our department head meeting yesterday, we also discussed the importance that if we need something right now, if the situation presents itself where the health department needs to get their hands on some money, the emergency services needs to get their hands on some money to deal with the potential impact that this COVID-19 pandemic could have on the county, we had discussed it would be good if we could appropriate into disaster relief funds from fund balance about $150,000 just to have there and available at our disposal should that need arise. That way we could do that and move forward without having to hurt their operating budget or to come back before this board to get that approval. So with that being said, Lori has prepared the budget amendment, and again, this budget amendment will take $150,000 from fund balance and put it in to the operating budget into a disaster relief fund line item.
And that'll be at your discretion, right, Mr. Manager?
Yes,
As to
yes.
who applies, if Warren comes, if Harmon or
Yes.
whoever.
And it's still and like I say, we'll be participating in a webinar, learning some more as we go along, just because we're on some uncharted ground in some of these things, but we're logging hours. The health department and their staff are logging all their hours. Warren and his staff, the sheriff, everyone is keeping track of all expenditures that this county is undertaking and has underwent so far in response to this situation. And it is our intent when the dust has settled here and we prevail, that we will attempt to be reimbursed to the fullest extent possible.
Make that into motion.
So with that being said, I'll pass this down, a copy of that budget amendment, and ask that the board entertain a motion to approve the same.
Make a motion be approved as presented.
Second.
Second, I would like to add just a remark, Derek. If you could just run that by one of us commissioners or to me as general whenever you're going to spend those funds, and I'll shoot an email, or just shoot an email. How about this? Just shoot an email out to all of us. Just kind of give us a heads up on what those funds will be expended for.
Sure.
All right? All in favor, signify by saying aye.
Aye.
Aye. All right. Based upon our Emergency Services Director's recommendation, I will be declaring a state of emergency for the reasons listed. And I will sign this right now.
Can
That
you
needs to
just
be read in the
elaborate?
record.
Yeah.
What's
Can
that?
you elaborate just a little bit on what I read it?
When I know it opens up some funding, it also opens up some other opportunities. But
Essentially what that does is it allows us, if we have to create some local regulations if necessary. We really haven't done that with this one. We copied the governor's executive order for the mass gatherings, and then we basically boilerplated the North Carolina general statutes for the price gouging. But the biggest thing it does is it opens us up for any federal disaster funding that may become available. That's one of the boxes that you have to check in order to even qualify for those funds. And I'll reiterate what Derek said. The funds that you put in there, that could be anything as minor as we've got some orders out for some protective equipment that's back ordered till June. We've had to do some rental stuff for some equipment. It could be something as simple as that, or it could be something major. But the last event that we actually received reimbursement for occurred roughly the fall of 2016. And I don't believe we finalized the reimbursement till almost fall of 2017. So just because you hear on the news that the funding's there, they don't mail a check tomorrow. So that's certainly a huge benefit that you have that fund balance for us to fall back on.
Do you think they'll lower the threshold, Warren? You have to meet a certain threshold, I know.
I have never seen an event that covered the entire United States and our other territories. Typically, that threshold is not lowered for disaster funding, and the losses have to be really significant based on a lot of our losses, for instance, for Macon County would be based on a percentage of what our operating budget is. This is all uncharted waters, so I don't know where we'll be with that 12 months down the road.
All right. Well, thanks to everyone for being here and being in attendance and listening and understanding in a good, calm manner. Is there any other items that we need to discuss?
Would
Mr.
just
Manager?
like to add one thing for the public, that want to stress that IT has put some important links on the county's homepage related to more information on COVID-19. So please, we've discussed many times here today the importance of consistent and reliable information, and that information has been placed on the county's website.
And one more announcement, Mr. Chairman, is during this time when, on mental health issues, when it's, we are seeing more and more folks having some issues with anxiety and a lot of other reasons, as you can imagine, who've already experienced some mental health difficulties. But as far as we know today, the walk-in center is operable. VIA continues to send out updates. That also will be updated to the public, as this affects a large number of folks in our area also. So, but as of right now, the walk-in center have taken some special precautions, but it is still open, and it's been very busy at their location.
All right. Well, again, thanks everyone. Thanks to everyone here. It's very calming and reassuring from our behalf to see the confidence, level of professionalism, and overall experience that will be as we're moving forward to handle this, what I would call somewhat of an unknown. It's also comforting to know that we have the financial capabilities to move forward with it without too much stress. So again, everybody stay safe, and I presume we will see you on, we're going to adjourn this emergency meeting. We're going to be having a meeting next.
23rd.
The 23rd, which is now going to be
Open and shut.
open and closed. So that'll be at our April meeting before we conduct any further business. So that being said,
Motion
get a
to adjourn,
get a
Mr.
motion
Chairman.
to adjourn by Commissioner Bill, second by Commissioner Shields. All in favor?